Look, I'm not going to sugarcoat this. If you're collecting Social Security or about to start, you need to hear what I'm about to tell you. Because the official numbers just dropped, and while they sound good on paper, there's a whole lot more going on beneath the surface that could either save you thousands or cost you dearly. The Social Security Administration announced a 2.5% cost of living adjustment for 2025. That's affecting more than 72 million Americans who rely on these benefits. But here's the reality check nobody's giving you. This increase comes with strings attached, changes to Medicare premiums, income thresholds, and tax rules that work together in ways most people completely miss. Let me break this down for you like you're sitting across the table from me. No jargon, no bureaucratic nonsense, just straight talk about what this actually means for your wallet. The real numbers behind the 2.5% increase. So what does a 2.5% bump actually look like in your bank account? For the average retiree, we're talking about an extra $50 per month. That's $600 a year. Now, before you dismiss that as pocket change, let's dig deeper. If you've been maxing out your Social Security contributions throughout your career, your monthly benefit is jumping from $4,873 to $4,995. That's a $122 monthly increase, or about $1,464 more annually. Not bad at all. But here's what most people don't realize. This isn't a flat percentage that everyone gets equally. Your actual dollar increase depends entirely on what you're already receiving. Someone collecting $1,500 monthly sees about $37.50 more. Someone at $3,000 gets roughly $75 extra. The math is simple, but the impact varies wildly. SSI recipients. Every dollar counts. For those receiving supplemental security income, the maximum federal payment for individuals is increasing from $943 to $967 monthly. That's a $24 boost. For couples, it's going from $1,415 to $1,450, a $35 increase. Now, I know what you might be thinking. $24. That doesn't sound like much, but let's be real here. If you're on SSI, you're living on extremely tight margins. That extra $24 could literally be the difference between filling a prescription or skipping it, between buying fresh food or going hungry for a few days. This isn't abstract policy talk. This is about real people making impossible choices with limited resources. SSDI, what changes for disability benefits. For those receiving Social Security disability insurance, the same 2.5% increase applies. The average SSDI payment hovers around $1,400 monthly, which means you're looking at approximately $35 more each month. But there's another critical change that affects SSDI recipients: the substantial gainful activity limit. This is the amount you can earn from work without losing your disability benefits. For non-blind individuals, it's increasing from $1,510 to $1,550 per month. For blind individuals, it jumps from $2,590 to $2,660. This matters tremendously if you're on disability and trying to work part-time or testing whether you can return to work. You now have slightly more breathing room before your benefits get affected. The Medicare Premium Reality Check. Here's where things get interesting. And by interesting, I mean potentially frustrating. While your Social Security check goes up, your Medicare Part B premium also increases. The standard Part B premium is rising from $174.70 to $185 per month. That's a $10.30 jump. Let's do some simple math together. Average retiree gets a $50 monthly Social Security increase. Medicare premium goes up by $10.30. Your actual take-home increase? About $40. That's 20% of your COLA adjustment gone before you even see it. This is exactly why you can't just look at the headline number and think you know what's happening. The devil is absolutely in the details. High-income beneficiaries, the IRMAA trap. Now, if you're what Medicare considers a higher income beneficiary, things get even more complex. This is where IRMAA comes in, the income-related monthly adjustment amount. For 2025, if you're single and your modified adjusted gross income exceeds $106,000, or you're married filing jointly with income above $212,000, you pay significantly more for Medicare Part B. These surcharges can add anywhere from $74 to over $443 on top of that standard $185 premium. Here's the tricky part that catches people off guard. These charges are based on your tax return from 2 years ago. Your 2025 premiums are calculated using your 2023 income. So if you retired in 2024 and your income dropped significantly, you're still paying based on what you earned when you were working full-time. The good news? You can appeal this. If your income has genuinely dropped due to retirement, loss of a spouse, or other major life changes, you can provide documentation and potentially get those surcharges removed or reduced. But you have to know to ask for it. The system doesn't automatically adjust. Working while collecting. The earnings limit. If you're collecting Social Security before reaching your full retirement age and you're still working, listen up. For 2025, if you haven't reached your full retirement age yet, you can earn up to $23,400 before Social Security starts withholding benefits. That's up from $22,320 in 2024. The rule is straightforward but harsh. For every $2 you earn above this limit, Social Security withholds $1 in benefits. In the year you actually reach your full retirement age, the limit jumps dramatically to $62,160. And Social Security only withholds $1 for every $3 you earn above that amount. Once you hit your full retirement age, game over. No more earnings limit. You could make millions and still collect your full Social Security benefit without any reduction. And here's something most people don't know. Those withheld benefits aren't lost forever. When you reach full retirement age, Social Security recalculates your benefit to give you credit for the months when benefits were withheld. It's not exactly dollar for dollar, but you're not completely losing that money. The tax trap nobody talks about. Let's talk about something that frustrates me every time I think about it. How Social Security benefits get taxed. Up to 85% of your benefits can be subject to federal income tax, depending on what's called your combined income. Your combined income is calculated by taking your adjusted gross income, adding any non-taxable interest, and adding half of your Social Security benefits. If you're single and that number lands between $25,000 and $34,000, up to 50% of your benefits may be taxable. Above $34,000, up to 85% may be taxable. For married couples filing jointly, 50% of benefits may be taxable if combined income falls between $32,000 and $44,000. Above $44,000, up to 85% may be taxable. Now here's what makes this absolutely infuriating. These income thresholds haven't changed since 1983. Let that sink in. 42 years ago, when a gallon of gas cost about $1 and the average house cost $70,000, Congress set these numbers and then just never updated them. Inflation has eroded the value of everything else, but these thresholds remain frozen in time. This means more and more retirees find their benefits subject to taxation simply because of inflation and cost of living adjustments, not because they're actually wealthier in real terms. The wage base impact. There's also the Social Security wage base to consider. This is the maximum amount of earnings subject to Social Security tax. For 2025, it's increasing from $168,600 to $176,100. If you're still working and earning above this amount, you'll pay Social Security taxes on an additional $7,500 of income. This might not directly affect you if you're retired, but it matters for the system's long-term funding and sustainability. Strategic timing. When to claim matters more than ever. If you're in your early 60s trying to decide when to claim Social Security, these annual cost of living adjustments should absolutely factor into your decision. Here's why. Every year you delay claiming between age 62 and 70, your benefit increases not just through delayed retirement credits, but also through these annual COLA increases. Those adjustments compound over time. If you claim at 62 with a smaller base benefit, future cost of living increases are calculated on that smaller amount. If you wait until 70, when your benefit is roughly 77% higher than it would have been at 62, those same percentage increases translate to significantly more actual dollars. Benefits you might be missing. Here's something that blows my mind. Thousands of people leave money on the table because they don't know about benefits they're entitled to. If you were married for at least 10 years, are currently divorced and unmarried, you may be eligible for benefits based on your ex-spouse's work record. These benefits also receive the cost of living adjustment. You can claim them even if your ex-spouse hasn't retired yet, as long as you've been divorced for at least 2 years and you're both at least 62. Survivor benefits work the same way. If your spouse passed away and you're receiving survivor benefits, those benefits increase with the COLA as well. The inflation measurement problem. Let's talk about something that doesn't get nearly enough attention. The COLA is based on the Consumer Price Index for urban wage earners and clerical workers. Specifically, they compare the third quarter average to the prior year's third quarter. The problem? This index doesn't reflect how retirees actually spend their money. Seniors typically spend a much larger portion of their income on healthcare and housing compared to working-age people. And these costs have been rising faster than the overall inflation rate. There's ongoing discussion about switching to an index that better reflects senior spending patterns, but nothing has changed yet. This means your actual lived experience of inflation may be significantly different from the COLA you receive. The long-term picture. Let's zoom out for a moment. This 2.5% increase comes at a time when Social Security's trust funds are projected to be depleted by 2034. According to the most recent trustees report, once those trust funds are exhausted, incoming payroll taxes would only cover about 77% of scheduled benefits. This doesn't mean Social Security is going bankrupt or disappearing. That's not how the system works. But it does mean that without legislative changes, benefits could be reduced by about 23% unless Congress acts. They'll need to do something. Whether that's raising the wage base cap, increasing the payroll tax rate, raising the retirement age, means testing benefits or some combination of approaches. Understanding this long-term picture matters because it should influence your retirement planning today. Don't put all your eggs in the Social Security basket. What you need to do now. So here's your action plan. First, calculate your actual net increase after Medicare premiums are deducted. Don't just look at the COLA percentage and think you're done. Get specific about your personal situation. Second, review your tax withholding. Are you having enough withheld from your benefits to avoid a surprise bill at tax time? Many people end up owing money because they didn't adjust their withholding when their income changed. Third, if you're working and under full retirement age, make absolutely sure you understand the earnings limits. Going over by even a few dollars can cost you benefits. Fourth, if your income has dropped significantly in recent years, investigate whether you can reduce or eliminate Medicare premium surcharges by filing an appeal. This could save you hundreds of dollars monthly. Look, the bottom line is this. The 2.5% cost of living adjustment for 2025 represents real money that will help offset rising costs. But the actual impact on your monthly budget depends on multiple factors working together. Your Medicare premiums, your other income sources, your tax situation, and whether you're still working. The key is looking at your complete financial picture rather than just celebrating or complaining about the headline percentage. The system is complex by design, and that complexity creates both opportunities and pitfalls. Here at Buck Breakdown, we're committed to cutting through the political spin and bureaucratic complexity to give you the straight story about how government policy affects your wallet. Because at the end of the day, this isn't about abstract policy debates. It's about whether you can afford your medications, pay your bills, and live with dignity in retirement. If you found this breakdown helpful, make sure you're subscribed to Buck Breakdown. We cover U.S. politics, the economy, business decisions, and government policy, all with the same no-nonsense approach. Because you deserve to understand how these systems work without needing a law degree or an accounting background. Stay informed, stay skeptical, and most importantly, stay engaged with your own financial future. Nobody cares about your money more than you do. That's it for today's breakdown. Until next time, I'm here making sense of the system so you don't have to.